Hello everyone, this is Maz again for AFK Prep Pharmacology video 2. So I want to go through some of the questions that are more pertinent to the AFK examination. I think these would be really helpful if you go through all of them, including the explanations. So let's start with our first question. Go ahead and you can pause the video anytime and you can go through the questions first as well. So let's go to our first question. The first question says that an emergency patient presents to our office for extraction of tooth number 48. So it is basically lower right third molar, because it is grossly carious and there is no opposing tooth. So basically the tooth is indicated for extraction. So as you know, it's important to review the medical history. So they have mentioned that in the medical history, patient mentioned that he is not taking any medication, so which is good, but he has a history of alcohol abuse. So while taking the medical history, patient says that he has alcohol history. However, he has been sober for the last 3 weeks. Okay, now he has stopped consuming alcohol for the past 3 weeks at least. There is no other disease that he is suffering from. On a clinical exam, he has limited mouth opening, ipsilateral lymphadenopathy, and swelling. You want to prescribe antibiotic to subside the swelling before extraction. Which antibiotic would you like to avoid in this patient? As you know that this patient is present with limited mouth opening, trismus, and lymphadenopathy and swelling, so it's very difficult to do the extraction. So in this case, you would like to prescribe antibiotic for a couple days to subside the infection and swelling. But the patient has a history of alcohol abuse, although he has been sober. But the question is asking like basically which antibiotic would potentially interact with the alcoholism. So let's go through the options. First, it's a penicillin. Penicillin looks like a good drug for this setting, and since considering its antibacterial coverage, I think it's a good choice to use for this patient. Second is clindamycin, as we know that it also covers anaerobic bacterial coverage. Trimethoprim, it's another class of antibiotic drug, and cephalosporin. So basically we are looking for a drug that has possible interaction with alcohol abuse. So based on my knowledge, actually it's the cephalosporin class of drugs that interact with the alcohol. So let's go through the options and explanation. So yes, the correct answer is D. So basically patient has history of alcohol abuse, and the only antibiotics in the list that interact with alcohol and causes disulfiram like reaction. So basically the alcohol interaction is disulfiram. So it is basically cephalosporin. So we know that disulfiram is used sometimes for the treatment of chronic alcoholism, and usually when they interact they produce a byproduct which can be cause of a hangover. So in addition to this drug cephalosporin, I would also remember for the AFK exam few more examples which can be the cause of disulfiram like reaction with alcohol. So these are includes metronidazole. This must be memorized. Second is first generation sulfonylureas, such as glimepiride, glipizide, and then anti-anginal drugs such as nitrates. So I would certainly memorize these drugs in addition to the drugs cephalosporin, which can be a cause of chronic disulfiram-like reaction. So in conclusion, we know that metronidazole, cephalosporin, sulfonylureas drugs, and nitrates all can cause disulfiram-like reaction. And it's important clinically as well as for the exam. So now let's move to our next question. The next question says that which of the following antihypertensive drug acts by reducing the release of renin from the kidney? So basically asking for the mechanism of action of the antihypertensive drug which acts on the kidney. So let's go through the option. Alpha blocker. So we know the alpha blockers, it blocks the alpha receptors on the blood vessels. So basically alpha 1 are the main receptors that are present on the blood vessels, and their their stimulation basically causes vasoconstriction. So when alpha blocker acts on the alpha receptor, they block those receptor and causes vasodilation. You should also remember some of the name regarding alpha blockers. The next as beta blocker. We all know that it's on the heart. So they are basically cardioselective beta blocker and non-cardioselective beta blocker. So such as atenolol, metoprolol, acebutolol. These are beta blockers. They basically act on the kidney, on the heart. The third is the ACE inhibitors. ACE inhibitor, basically there are angiotensin converting enzyme inhibitor such as captopril, enalapril, lisinopril. They also are antihypertensive drugs, but they act on the enzyme angiotensin converting enzyme which acts on the blood vessel and causes vasoconstriction. The fourth one is angiotensin receptor blockers. So the angiotensin receptor blockers, they basically blocks the receptor of the angiotensin converting enzyme. So they also act as antihypertensive drug. However, the question now is asking for the reducing the release of renin from the kidney. So from all these options, beta blocker, in addition to blocking the beta receptor on the heart, they also block the beta receptor present on the kidney juxtaglomerular apparatus, JG apparatus. So in the kidney we have a JG apparatus which releases renin. So basically it prevents the release of renin by blocking beta receptors. So our answer choice here is B. So here's the explanation. Among the choices, only beta blocker act on the beta receptors and they reduce the release of renin. So go ahead and read the slide for yourself. And I want to show you one thing here. Go through this slide again, and as you know that we have angiotensinogen enzyme which is basically released from the kidney through the influence of renin from the kidney. So once the renin is released from the JJ apparatus, it releases angiotensinogen. So this angiotensinogen, it travels to the lungs, and here it converts angiotensin 1 into 2. So basically in the next step, that's where ACE inhibitors drugs acts. And in the third step, angiotensin 2 there goes and again act on the receptors on the blood vessels and kidney where the angiotensin receptor blockers work. So basically this is a diagram. So it goes from kidney to lungs and then back to the blood vessels and kidney. So in these steps, each of the drugs, class of drugs act. So beta blocker work in the first step, then ACE inhibitors acts on the second step, and angiotensin receptor blocker acts on the third step. So now let's move on to the next question. Okay, so this question asking about St. John's wort is a common herbal medication used for depression. It is actually a herbal medication that fights depression in patients. So it is important for dentists to know this herbal drug. Okay, Very interesting. So this is a herbal medication that is usually used for, it acts as antidepressant. But why do we need to know this? Why do, as a dentist, we need to know about this drug? So it could be one of these 4 reasons. So go ahead and read the reason. First, it says it inhibits the absorption of other drugs from the stomach. It induces hepatic enzyme, which is CYP3A4. It displaces other drugs from plasma protein binding, and it inhibits cytochrome P450 enzyme in the liver. So in this case, it looks like this antidepressant herbal medication has lots of drug interaction, but in what way? So from our pharmacology knowledge, it says that it actually, the reason that this drug is important to know is because it induces the hepatic enzyme, which is CYP3A4. So it is basically a member of the family of cytochrome P450 enzyme. So the answer choice D says it inhibits. So basically it does not inhibit, but it induces CYP3A4 enzyme. And so when it induces this enzyme, it causes metabolism of the half marketed drugs in the US and Canada that are in the market. They are basically metabolized by this enzyme in the liver. So if a patient is taking St. John's wort, this would basically interact with half of the marketed drugs. And some examples of other drugs that are metabolized by CYP3A4 are calcium channel blockers, cyclosporine. Which is basically immunosuppressant. Benzodiazepine, you all are aware of this. Antifungal drugs such as ketoconazole, fluconazole, or azole drugs. Another drug that interact and metabolized by this hepatic enzyme is erythromycin, which is basically a macrolide. And then we have some SSRI drugs such as fluoxetine, sertraline. These are all the drugs that are metabolized by this enzyme. But if patient is taking St. John's wort medication, so it will reduce the efficacy of these drugs. Go ahead and read this slide for yourself. It is self-explanatory, and you will get a good idea of what I'm talking about. The next question on the slide is, okay, and again, disulfiram inhibits which of the following enzymes in the body? So it is similar to the previous question we talk about chronic alcoholism, and we already mentioned that disulfiram is one of the treatment for chronic alcoholism. So it basically which kind of enzyme it acts upon in the body. So we have monoamine oxidase. Monoamine oxidase is basically an enzyme that is acted upon by epinephrine. Angiotensin converting enzyme, we already know that it is an enzyme that converts angiotensin 1 into 2, and it is acted upon by ICE inhibitors. The fourth option is acetylcholinesterase. It is basically an enzyme, and it acts on the neurotransmitter that is present in the synaptic cleft at the neuromuscular junction. So it basically acts on metabolize acetylcholine. So the last choice that is left with us is aldehyde dehydrogenase, and it is basically this enzyme that is acted upon by disulfiram, and it causes accumulation in the body, which leads to hangovers. So the choice here is option C, aldehyde dehydrogenase. So you can see that in the treatment of chronic alcoholism, disulfiram is usually given to patient, which inhibits hepatic aldehyde dehydrogenase enzyme. This basically leads to accumulation of alcohol byproducts. So basically what happens is when the patient is taking alcohol, it is converted into acetaldehyde byproduct. And this happens with the help of aldehyde dehydrogenase. Right? So disulfiram basically inhibit the hepatic aldehyde dehydrogenase enzyme, and which does not metabolize further the acetaldehyde. So acetaldehyde basically is accumulated in the blood, which can lead to symptoms like hangover, which includes nausea, vomiting. The patient can have headache, palpitation, and other cardiovascular uh, collapse events. For the AFK, I would also remember the other agents that can be used for the treatment of chronic alcoholism are naltrexone and acamprosate. So these are the drugs you should remember: acamprosate and naltrexone. Naltrexone is basically opioid antagonist, so it's also used for opioid abuse as well. For the AFK, we'll also remember the action of these enzymes as well, which are present here in the other options, such as monoamine oxidase. It metabolizes epinephrine in the body. Angiotensin converting enzyme, this inhibited by the drugs such as SE inhibitors I already mentioned: captopril, enalapril, lisinopril, alpril. And lastly is acetylcholinesterase enzyme, is found in the synaptic cleft, and it acts upon the and metabolizes acetylcholine. Okay, the next question, and this is the last question of our slideshow. Which of the following conditions is most concerning to the use of NSAIDs in the first trimester of pregnancy? Okay, as we all know that NSAIDs should not be prescribed during pregnancy. However, this question is asking about the most concerning effect of NSAID that can be caused during the first trimester in pregnancy. So let's go through the option. So it aggravates gastritis in pregnant patient, which seems correct. Yes, all NSAIDs can aggravate gastric ulcers and gastritis, because we all know that. Even the non-pregnant patient can experience this with the use of NSAIDs. The next option is causes premature closure of patent ductus arteriosus. So it is basically a duct that is formed in the baby's heart, but once the baby is born, it gets closes naturally. How it causes premature closure. So it could happen. Okay, let's go through the third option. It causes premature labor. And we all know that NSAIDs causes inhibition of prostaglandin, and it has also to do something with labor. So it also is very confusing. So let's go through the fourth. Or induces asthma in young pregnant patient. Well, yes, it does induce asthma, because in NSAID, we have a cyclooxygenase and lipoxygenase pathways, and NSAID basically inhibits cyclooxygenase COX-1 and COX-2 pathways, which leads to the production of prostaglandin. So through the NSAID, we inhibit the production of prostaglandin, but alternative pathway, which is the lipoxygenase pathway, it is activated and it produces leukotrienes. So the leukotrienes are basically responsible for asthma. So NSAID, yes, they do aggravate asthma in already existing patient, but what's the most concerning thing here? So the most concerning thing is the option B, which is the premature closure of ductus arteriosus. So let's go through the explanation and what does it say. So NSAIDs causes premature closure of patent ductus arteriosus when given to pregnant patient in first trimester. Okay, so in the first trimester, we all know that this is all the organogenesis happens. Your hearts form, lungs form, and all the major organs, the vital organs in the body are formed. So NSAIDs, if given during that time, it can affect all the organogenesis process, and the most some studies has shown that it has lead to the premature closure of patent ductus arteriosus in babies. Okay, the next one, though NSAIDs can cause gastric ulcer in some individuals, however, it is not directly related to the first trimester. Okay, so gastric ulcer can be caused in any patient, whether it could be first trimester, second or third trimester. If it is a normal, healthy individual, it can cause gastric ulceration, both men and women, irrespective of the gender. So this is just a journal vague questions option. Basically, the use of NSAID may lead to premature labor if used in third trimester. Okay, so if the question is like, what's the most concerning thing of the use of NSAID during third trimester, then this would be the option. So the use of NSAID may lead to premature labor because inhibit prostaglandin. So this would be the most concerning thing in the third trimester. However, in the first trimester, it's the premature closure of patent ductus arteriosus. NSAID does not induce asthma in young pregnant patient. However, if aggravates asthmatic attack if patient is already suffering. So basically, NSAID do not cause asthma. It is not a causative factor for causing asthma, but if the patient is already having asthma or COPD disease, it can aggravate those conditions. So this is the end of our slideshow for today. I hope you enjoyed the video, and let me know, give me a thumbs up if you like me to continue making new videos like this. I hope this will be helpful for your AFK exam, and all your feedbacks are really welcome. Thank you so much. Have a good day.